So hereditary hemorrhagic telangiectasia, which is the second most common hereditary bleeding disorder in the world, is a bleeding disorder that is associated with obviously increased bleeding complications, but additionally an increased risk of thrombosis. So these patients, unfortunately, are often caught between sort of a rock and a hard place in that they may develop a thromboembolic event, or they may develop atrial fibrillation, or they may develop some indication for antithrombotic therapy, but at the same time, they have chronic bleeding, chronic epistaxis that can be severe, recurrent, chronic gastrointestinal bleeding. These bleeding issues can result in iron infusion dependence, blood transfusion dependence. It can be really challenging sometimes. And so we looked at a very large cohort for this disease of patients over 2-decade span, evaluating how these patients do with antithrombotic therapy, because very little has actually been published on this topic. So much so that the current recommendations in the HHT guidelines regarding anticoagulation and antiplatelet therapy are very largely just based on expert opinion alone, and then a few very small case series and cohort studies. And what we found is, unfortunately, about half of patients with HHT do very poorly on antithrombotic therapy. The majority of that half, about 40% of all patients, ultimately discontinue prematurely. Another proportion have to dose reduce or go to a sort of sub-therapeutic option, like switching to a baby aspirin instead of therapeutic anticoagulation, for example. We recognize that just about any kind of antithrombotic therapy, everything from a baby aspirin all the way to therapeutic warfarin, heparin, or a DOAC, really has a similar rate of complications in these patients when it comes to bleeding. So, it's really, in some ways, it's confirmed what we suspected, but in other ways, it's been an eye-opener in that when patients have an indication for antithrombotic therapy, which is, again, relatively common in these patients, we need to think about, approaches that will maximize the patient's likelihood of being able to be properly anticoagulated, such as, for example, thinking about concomitant initiation of anti-angiogenic therapy, systemic therapy, that can reduce their bleeding. These approaches, of course, need to be evaluated in future studies, but our study really did kind of establish this baseline level of understanding.